This is Delhi. Please stand by for our next program. This is All India Radio. In our national program of talks tonight, we bring you a panel discussion entitled The Learning Curve. The panelists are Dr. Lata Bhat, leading Paediatrician and behavioral and developmental expert; Mohit Ahuja, founder Knowing Disability Initiative; Nishtha Gupta, former autism awareness and technology advocate; and Amit Arora, media personality who initiates and moderates the discussion.
Hello and welcome to the national program of talks as we focus tonight on the topic, the learning curve. Every child is unique and aspires to learn and grow in their chosen field. However, the learning curve could well have some challenges like excessive screen time, say neurological conditions like dyslexia, autism. Let's understand how best we can address these challenges. My name is Amit Arora, and joining me in the studios of All India Radio Delhi are three distinguished guests. Please welcome Dr. Lata Bhat. A warm welcome, Dr. Bhat.
Yeah, thank you, Mr. Amit. Thanks for welcoming me in this show.
Also with us is Nishtha Gupta. Welcome, Nishtha.
Really nice to be here. Thank you.
And our third guest is our professional photographer, Mohit Ahuja. A very warm welcome, Mohit.
Thank you, Amit.
So let me begin by asking Dr. Lata, every child learns differently.
Yeah.
So what is an ideal learning curve like?
The ideal learning curve, as we developmental pediatricians call, is we have developmental milestones assigned for each milestone the child achieves, like for walking, sitting, standing, eye contact, speaking, everything. So a child should be ideally following the developmental curve. But however, most important thing is it should be appropriate to the child's abilities, means child's cognitive abilities and the intelligence level. So that's an ideal learning curve.
And those abilities could differ with every child.
Exactly.
But has the society come of age to accept that the abilities could differ for every child?
Yeah.
I believe that abilities of children vary with time, among their ages, and of course with the society they are in. The amount of exposure a child gets, the amount of support they get, the amount of support from society or their own parents, their own ability, their own curiosity to explore, and then there is a factor of genetic differences. People with neurodiversity, people who might be on autism spectrum learn differently.
Okay, so those are some of the factors that impact the learning curve. What's been your experience? Any mental conditioning that has existed through ages that you believe has to be broken?
I think with time, it's also the mental conditioning of the parents by the society that makes a big difference. I think every kid, for that matter, I would not just talk about neurodiverse individuals. The kind of things that have been taught, for example, in today's day, there are so many creative jobs out there. But 20, 30 years back, the parents were conditioned to believe that only an engineer or a doctor is a good kid.
Yes.
So I think the learning curve also happens on the parental level before it passes on to the child.
In your case, was it easy for your family to accept that a photographer could also be a good kid?
Oh no. My dad was very disappointed when I quit my job, a nice, cushy corporate job, and started to do things on my own. And it has been a learning curve ever since. It's been a very steep learning curve. I'm happy about that. But I think the only way to look at it, even as a parent or as a kid, I would say is quit every night, join back every morning. Don't think that 3 years down, this is where I will be as a parent or as a child.
Okay.
I think just take it one day at a time. And this is an advice which I got from parents I worked with who have kids with, challenges.
Okay.
Neurodiverse individuals.
Excellent advice. Take the day as it comes. Very nice. Dr. Bhat, let's start with some tips for parents only. Because parents are your best well-wishers.
Yeah.
But the irony is sometimes they could say a few lines or a word that could really hurt the child.
Yeah. So coming to the parents, since I'm a pediatrician also, I'll start from birth. First and foremost, I'll say accept your child as he or she is. That's the most important thing. Provide a warm, nurturing atmosphere where the good nutrition is provided. The child is well taken care of. So that's called as nurturing care.
Okay.
Responsive caregiving means don't just go by what norms you have in your mind. You respond to the child's need because every child has different needs. So that's known as responsive caregiving. And then you also have to provide a very stimulating atmosphere. If both the parents are at home watching their mobile or watching the television all the time, and they think that we are at home but actually are not available to your child. So responsive caregiving and stimulating atmosphere means that you have to play with your child. You're the best toy that the child has. Second point which I would like to say is, this is so far as normal parenting is concerned. Since today we are going to talk about all the kids who are on different levels of neurodevelopment. So at the time of birth, we have certain high risk factors, which we tell the parents. Like supposing a child is born premature, if the child didn't cry at birth, or there are some abnormalities in the child, or some child had hypoglycemia, low blood sugar, low oxygen levels at birth. So we tell the parents this child is high risk for delay in development. So parents should take it very seriously, because what I'm finding in the city is every parent wants the child to achieve 98% or be a certain individual, but they do not understand what the doctor is trying to tell at the time of discharge, that if I tell that your child is at high risk for poor development or developmental delays, take it seriously. Approach your doctor, your pediatrician, get the development charted out. You can also get it because there are so many charts for parents as well. And then plot the child's development, and wherever there's slightest of concern, please approach your pediatrician and they will refer you to a developmental pediatrician for further assessment. So important thing is to keep an eye early so that we can do early intervention. Now here's very important message to the parents. If we intervene before 2 years of age, at birth the brain has only 36% of neurons. By 5 years, whole brain development is complete.
Okay.
By 2 years, 88% brain development is complete.
Okay.
Which means you approach for early intervention at least before 2 years of age. The earlier the better. Then the child will possibly achieve his best potential. We're not comparing children. Never compare, never criticize is the point we tell all parents. But every child should achieve his or her best potential. And the best gift you can give to your child is at your time.
Okay, so accept the child, give them time, don't compare. And if you have observed any early signs of any milestone, then do consult the pediatrician in time. Let me discuss about autism. Nishtha, you have the experience of working with children with autism. So first of all, tell the listeners of All India Radio, what is autism?
Autism is a neurological disorder with which children are diagnosed at birth. Because there is not a lot of awareness, the diagnosis is often delayed, but it's not something that people acquire over time. It is something that they're born with. And with this disorder, they suffer a number of challenges, mainly around social interaction, communication. So the child might be smart, but because their communication is inhibited, their understanding is inhibited, their speed of growth is going to be much more limited than the speed of growth of neurotypical children. There is a common misconception that children with autism are brilliant or genius or savants. Well, they could be, but that's a very, very small fraction of the entire children base. Most of the children, more than 90% of them, struggle with basic communication. They struggle with their day-to-day activities, and thus their development is delayed, and a learning curve for them has to be defined differently, as well as the facilities, infrastructure that is provided to them to grow at their own pace needs to be defined differently.
Okay.
Just a message to the parents that this autism earlier days was taken as, a big neurodevelopmental disorder, and people were scared of it. But right now, with the available facilities and therapies, that concept of being scared of autism is now reducing. Second thing which I have noticed, and people like me who work in this field have noticed, is ever since the screen time has increased, most of the autism, we call it as virtual autism. So what I'm seeing in my practice is 90% kids are improving 100%, which means they present like autism, but the autism is because of excessive exposure to screen or whatever, problems have been there in taking care of the child. So these kids are improving 100%. So parents should not think that once someone is diagnosed as autism, my child is never going to improve.
Okay.
So with the current available therapy, since it's a spectrum, right? Spectrum means there are some mild, some moderate, from severe cases. So what I have found is those who fall in the mild or moderate end of the spectrum, they really improve. Sometimes we feel there are no traces of this problem remaining. Those at severe end of the spectrum, they still struggle with communication and social skills.
Okay.
So that's what my experience is.
Right.
So that, the parents are not scared of the word.
Okay. Yeah. Mohit, what has been your experience with neurodiverse children, particularly when you had this beautiful vision of helping them follow the passion of photography?
So my experience has been good. I was just listening to what Nishtha was saying, and you're talking about infrastructure, and ma'am's talking about parenting. There's a good side and a bad side. The good side is the kids have been dealing with mostly are kids in the metropolitan cities. There the parents have that information and infrastructure both, right? Where they know that, okay, this is, let's say my kid has been diagnosed with autism. I will go to a therapist, I'll go to a counselor, I'll go to this, that. But the reality lies 30 kilometers outside these metropolitan cities. And that is the harsh reality. No matter how much I think you need to do and the government needs to do a lot more work here.
So what is the harsh reality?
The harsh reality is that kid with autism might be dealt with as a neurodiverse kid in any private and public schools.
Okay.
The government schools are also doing a great job in today's date. So that is there. But the moment you go outside 30, 40 kilometers outside a metropolitan city, a kid with visual impairment is still called andha. Right? They still don't have an identity. A person who's missing a leg, who's born with, or maybe not given polio drops on time, or has a physical deformity, is still called a Langda or a Tunda. Those are the branding that we give them all the time. And that is the identity the parents also live with. I was just listening, and spectrum means a circle, right? I think the parents also need to be reached out to. There are programs other countries have, and I think we should have programs on parenting where the parents are told how to deal with these things, because we might be looking at the milestones of the child. We have the milestone that the child has started talking or walking. But are we measuring the milestones of the parents? Do the parents know?
Right.
That's a very harsh reality, and I think we need to face it. Otherwise, it will be too late.
And in terms of the nomenclature, you call them superhumans.
I call them superhuman, and I think it is a very simple derivation, because doing something without you're an RJ, right? If you have a bad throat, can you do a show that day?
Very challenging.
They are living a very normal life with a lot of things they don't have, that we so-called normals of the society have. So I think it's all about reaching out to the parents. It's a very important term, and I've realized it day in and day out that the smaller cities, people don't know about it. I can tell you this, a personal experience. I am also a cancer survivor.
Okay.
And I've seen kids in government hospitals where the parents don't know their blood group. The parents, they don't know their own blood groups. How will they arrange blood for a kid? Okay. And this is normal parents, normal kids.
Nishtha?
I have worked with children with autism who were in the severe range. And when I was working at the hospital, I was told that comprises the majority of the children, and they were not from the city. The children would come from far-off villages, and their parents would have sold entire lands just to be able to afford their daily therapy, to be able to come to the city to afford their treatment. So I believe there needs to be more support, say via technology or entrepreneurship, by our youngest, most brilliant of minds, to be able to support this situation in India, and not just in India. This situation is very, very prevalent in Asia. Europe and America are far more advanced in terms of leveraging technology to enable studies and learning of typical children as well as neurodiverse children, whereas India and other countries in Asia have still a way ahead to go to speculate how we are going to train these children, how are we going to train their parents, how are we going to leverage technology and other business ideas to enable their daily learning as well as empowering them for vocations in the future, so they are self-dependent going ahead.
Right. Well, I will ask you some activities where we have leveraged technology to the benefit of people. But let me ask Dr. Bhat first. We've heard about autism, and the other word that we hear is dyslexia.
Yeah.
What is the difference between the two, or is there a common overlap?
So first, can I just add one line to the discussion which was going on? I believe is like they say a blind man is blind, but he has abilities in certain areas which are far surpass a neurotypical individual, right? Similarly, in autism also, they have this typical repetitive behavioral pattern. They can repeat a task a million times, endlessly without getting bored. So probably the government and the system needs to understand, even the parent needs to understand that every individual is born on this earth because they're supposed to contribute something to the society. So if we can accept them as someone who is different, not typically individual which we have already been seeing, they can be an asset to society actually. That's one thing which I always tell the parents. Maybe he's an asset to the society.
Right.
You'll be proud of him later on. So now coming to dyslexia. So autism by definition is actually related to pre-verbal and pro-verbal communication. That means speech and non-verbal without talking, the gesture, the eye contact, social smile, finger pointing, command following. These are all pre-verbal skills. So autism is a delay in communication. Pre-verbal, verbal communication. They lack in social skills.
Okay.
They have repetitive behavioral pattern, and they can have some sensory issues.
Okay.
Like they can be hyper or hypersensitive to touch, vision, hearing, fine touch, body awareness, everything. So that is autism. Dyslexia is pure learning disability, right? So there's difference between autism and dyslexia. Autistic child can have dyslexia, may or may not have dyslexia. Now coming to dyslexia, by definition, let's put dyslexia is only one spectrum of the learning disability, right? The specific learning disability which you talk about. Dyslexia means the child has problem with reading. Reading means they cannot connect phonetics with letters.
Okay.
So each letter has a sound, they cannot. Since they cannot connect between the phonetics and the letter, they cannot read words. Right. And so on and so forth. So that is dyslexia. And obviously, inability to read is a huge disability in life.
So that will impact almost every
all
subject.
All spheres of life. You can't learn if you can't read. Because initially a child reads to learn. Later on, you learn to read to be able to survive even.
How will their learning curve get impacted then?
Yeah, a child with dyslexia who cannot read cannot achieve a normal learning pattern like any other child. He can't read means he can't learn what he's supposed to learn. So he can't grasp maths, he can't learn English, all the languages. And if you can't read, you can't obviously understand, then you can't. But then again, I'll just divide it. So some kids are dyslexic, can't read. Some kids are dyspraxic. They can read, but they can't write. They have problem with fine motor skills. They're basically problem with holding pen and writing. The third is a person who is dysgraphic. They have fine motor problems. So coloring, drawing, images, all those. And then the fourth end is the dyscalculia, means mathematics. So all four are equally important and for learning.
So all four are basically under the canvas of dyslexia.
Learning disability.
Learning disability.
Yeah.
But if any of these children were to come to you, they can learn photography?
Anyone can learn photography.
Yes. Maybe fine motor skills, if they are poor, it might be a bit difficult.
They are always aids. So people with fine motor skills, they are remotes for cameras. See, understand this. I think we need to step back and look at everything that we are doing with these kids and look at how we are dealing with it. Right? I think half of the time, most of the time, I would say not even half, I think most of the time, people with challenges suffer. And I'm not just talking dyslexia or autism, I'm talking about Down syndrome or physical deformities even for that matter. People who have a 100% functioning brain, who have no diagnosis, a mental diagnosis that way, but have a physical deformity. I think we need to step back and look at where we are creating a pattern where we start looking at labeling them that, okay, this is not something for you.
Okay. We should not do that.
Yeah.
They are capable of doing everything.
Definitely. Just look at it. Just look around you. There is a WHO number I read somewhere that more than 10% of the world's population is challenged. If I'm not very good with mathematics, but if that means roughly 10 people out of 100,
right,
or 1 out of every 10,
okay,
how many do you see sitting in a cafe enjoying a coffee by themselves? Never. We have put them into boxes, we've closed them, we've told the parents that it's not good, it's not a good thing that your kid has autism or dyslexia. And for that matter, look at how we are functioning now. We've come so far. I think only the past 5 years we've started talking about menstrual hygiene.
Yes.
So autism and dyslexia are still a very different, very distant dream.
But I think this distant dream could well be fulfilled now with accelerated pace because of technology. Can you share some example, Nishtha? How have we harnessed technology to enable children, say, with autism?
So we can divide this technology into two parts. First of all, technology that enables their learning. Second is technology that enables their vocation. Currently, there are technological aids which are in US, Europe, very less in Asia, but still present, that help such people go about their daily lives. For example, if they are struggling with motor skills, then there might be technical equipment that can assist them with those technical motor skills. If they are children with autism who are non-verbal, then there might be aids that would help them speak as in point to the right pictures in a book or a device to be able to communicate their thoughts. So like Dr. Lata said, I would totally agree to her and Mohit, that there are certain things that they can do and they can do it really, really well. And when we talk about coming into vocational assistance, vocational technology, we need to understand, can we harness these unique skills to enable vocation for them? For example, if a child with autism or Down syndrome can cook, let's say they can cook two things. Can you make a canteen for them with the help of technology, where what you do, you keep a menu where a customer would come and just press a button. The person with autism or Down syndrome knows how to cook it really well. They will go cook it and automatically the payment is done, say automated payments. And then after that, there is a backend system that manages the inventory to refill the inventory, and there's an order at the backend that automatically goes to the vendor to refill that inventory. So here, the child with autism or Down syndrome or any other learning disability learnt only to cook. But the technology enabled that child to run a vocation to earn for themselves.
Right.
Of course, some people might go ahead without a caregiver their lives, but a lot of them will need caregivers.
Right.
But that does not mean that they have to be dependent. Technology can empower them, and I would really like to talk to our wonderful youth these years.
Yes.
I mean, you have come far from where we were in our childhood, and you have all the resources, the technologies, internet to be able to search about it. There are companies which are willing to fund such endeavors.
Yes.
So think, it's a challenge for you. Think how you can harness the unique abilities of people around you and turn that into a vocation.
Right. Technology indeed is a force multiplier. We talked about parents. Let's talk about teachers. What's your tips for teachers in school so that they can be more sensitive? And could you also share that when we have a PTM, parent-teacher meeting, in addition to the academic grades, what issues should be brought up?
Yeah. So coming to the teachers, now what has happened in the current times is schools have become places where a kid achieves a certain percentage, gets admission into A college or a B college, right?
Yes.
And that's what the teachers are always under pressure. But I would advocate that this whole system should change, basically. And then the teachers should talk about overall development of every child and bring about the best potential out of every child, right? So which means that you are empathetic towards child, you're compassionate towards every child, and observe to find if the child is facing any difficulty. It's not that just you enter a class with 30 kids, you teach something, you write something on the board and you expect them to copy down. No, I think the teacher should give some time observing every kid and see if a particular kid has a problem.
Okay. So as a teacher, what has been your experience? How do you observe?
So I keep telling all the parents I work with that I don't have a degree of a special educator, but I have on-the-job experience of 36 years.
Yes.
Because my own sister is like that. So I think it's a learning curve for me as well as teachers also. And I think every time I teach something to the kids, I also learn from them. I think the teachers I had, if I had to take out a mistake that they made, was they dealt with every kid the same way. And that is the biggest mistake. Yeah. Every person is not the same.
How will we change this? Because this is the week we are celebrating Teachers' Day as well. While we have reverence and gratitude for every teacher, do you think modern times require a teacher to focus, as Dr. Bhat said, on holistic development and not just the grades?
I totally agree with that. And this is something which has been happening in city schools. They are focusing on the overall development of children. The focus on academic studies is reducing a bit, and extracurricular like swimming, dancing, that is increasing. However, when we come to the world of people with special needs, I understand that the awareness is growing over time, but of course, the educators, the special educators, need to be made more aware about the state-of-the-art researches in teaching.
Okay.
I have met educators who treat each children differently. Some children might react to weight training, which is a case for hyperactive children. They are given weight and that weight calms them. While some children become even more aggressive when weight is put onto them.
Okay.
I'm of course not a certified special educator. I rely on their expert knowledge for all these issues. But every child grows differently. And that's not just true for autism or neurodiseases. Whenever there is any disease or any drug in the market, different bodies will react differently to that drug, maybe within a range, but differently.
Okay.
And at this point, I also wanted to bring into picture how society or teachers play a role in the growth of a child. Let's not talk about neurodiverse children. Let's talk about my upbringing. I grew up in very small towns of Rajasthan, and I didn't go to a formal school. I was playing chess at an international level. I was focused there, so I never had the chance to go to school. When I went to school, I opted for math, science, cleared IIT, and got into the college. But when I talked to more and more of my female students in school, none of them thought that they were math brain, because the society had really put it into their head that women cannot be good at maths, which was not true at all. Women have analytical brains, that has been proven, but the environment that you grow up in, the sentences that you hear every day, maybe as a joke, maybe by finding lack of role models in that area, within you they come under you and you kind of lose that confidence to take up something even before you have lost that capability. So of course, not everything could be extended to neurodiverse children, but the fact stays for the matter that what everyone hears on an everyday basis,
right,
the interactions they have every day,
yes,
and the kind of support they get is very detrimental and influential in the learning curve that they will take.
Right, and therefore the formative years and the upbringing of a child, those years are very important. Dr. Lata Bhat, child's upbringing also needs to include peer time. So how can we understand the importance of peers?
Parents should always enforce. As I think I already mentioned, that screen time should be 0.
Yes.
Below 2 years of age, and above 2 years, we say 1 hour per day for educational purposes only. Which means you are giving your child some time to play, right?
Yes.
So we say at least 1 hour of child's play should be there with the peer group. Because with the peer group is like you have a friend who is non-judgmental. Parents are always judgmental,
yes,
teachers are always judgmental.
Relatives also.
Yes, relatives are also judgmental. So your peer group time is wherein you play with your friends in an age-appropriate manner. That's one thing with others don't understand.
Right.
So your emotions and your play depends on your age. So you play with your peers in an age-appropriate manner. With people who are not judgmental. So that itself relaxes your brain.
Yes.
And a relaxed brain will develop much better.
Yes, absolutely.
Right? And they learn a lot from their peers.
Yes. Any experience you would like to share which is inspirational where when you communicated in such a way, it brought behavioral change? Because changing the behavior is not easy.
I think it's all about setting expectations. The very first mistake we make is we set expectations as parents, as kids, as society. We have expectations from the parents. Behavioral change comes when you don't have expectations. Every day becomes a miracle. Just start your day and don't have an expectation.
But is it possible, realistic, not to have expectations?
It is not realistic, but it's not impossible either.
How do we initiate ourselves into that direction?
Just go with the flow. I would just say, I'm not saying that you're a dead fish and you go with the flow, right? But what I mean to say is that let every day be a learning curve. A very small example I give to all the parents that I work with. Many times they're like, so the kid is not taking a good picture today. What happened? Yesterday he was performing. I was like, just go back 50, because the kids I work with are 15, 16, 20 years old. I'm like, just look at the parent, tell them that look at the first 4 or 5 years of the kid. For you, and this is for any parent, I'm not just talking about neurodiverse individuals, for you to get that kid to walk was a big challenge. Today, just because he walks normally, it becomes a thing that we take for granted. When you stop having expectations, everything that you do every day becomes a miracle.
So what is the best compliment children have given you when you taught them photography?
Oh, there are so many of them. There are so many of them, but I think the most beautiful, I think more than the compliments, it's when I see them win. It makes a big difference. Like one of my kids did a shoot for a very big motorcycle, a global motorcycle brand. Okay. So that was a compliment to see, because I've seen my own parents, and for a neurodiverse sibling, and to see my parents, the parents of a neurodiverse kid don't really have an expectation set by the society. They've been somewhere trained to have no expectation of ever being on stage. And here there was this kid with Down syndrome, and the parents were called, and there were 200 people applauding for the parents for what they've done with the kid. And I think those are those small wins. And the beauty of being a neurodiverse person, I would say, is that everything is a win.
Yeah,
for a normal kid, I think it's much more challenging, because this is a normal thing now. What's the big deal? You need to do this. And unless you are getting 100% scores, you're not a good kid. For a neurodiverse kid, I think even a 15% is celebrated. And I think that's a very big blessing, and we don't realize.
And do you think then, when we say a good kid or a bad kid, or sometimes when we say an autistic child or a disabled person, all of these are not correct. We cannot use good, bad, autistic, disabled as an adjective. Every child is unique.
Yeah. Every child is unique, and we cannot use them as adjective. I think adjective can use only for adults, like a bad adult not being able to teach the child properly.
It's inability to teach the child. Coming forward with Mohit's examples, the other day, and this will make things a little clearer because I'm facing regularly. So the other day when mother came, that my child is not able to write. And ma'am, within 6 months he should write. So she was pressurizing a special educator. So I called the mother. I said, when your child came to me, he was not speaking. Today he speaks. He's going to a normal school and he's doing well. He's not a machine. He's a human being, for heaven's sake. And human beings maybe even can achieve far greater results than what you expect. So just work with him, with his own abilities. So encourage his strengths and work with his weaknesses, so that we achieve his best.
Absolutely.
I totally agree.
And as you said, where we stand today, after 6 months, we will also see. But if you discourage him, we will definitely not reach there.
Right. So final words then, Nishtha. The learning curve will have some ups, downs, crests, troughs, but ultimately we can strengthen it by contributing together.
Right.
Yes, totally agree. It's not going to be a straight curve. Like Mohit said, that you don't have to compare the photo of today and tomorrow, but you have to see where the child was, say 10 years ago. And it is a mixture of combination of how the child is feeling about themselves, their confidence, their innocuous curiosity, as well as the support system provided by the parents, the resources, infrastructure and technology provided by the society, and in general, the understanding, compassion that we provide to those children. And of course, with the right set of medical, technological and familial interventions, a child can grow to their best of capabilities.
Absolutely. So we've got counseling help, technological intervention right there. And as Dr. Bhat said, we are all human beings. As Mohit said, that person with disability perhaps are superhuman. So we salute them for being inspirational and doing whatever best they can. Whatever they do is a win.
Yes.
So
Exactly.
I think whatever all of us do is a win. We just don't look at it that way.
yes, and let's see if the challenge that Mohit has given us of having zero expectation and living each day as it comes, we
Right.
can honor that. But it's been a beautiful conversation, very enriching talking to each one of you.
So we should celebrate each life, actually.
Yes,
Yeah.
let's celebrate each life. Thank you so much for joining us.
Same
Thank
honor.
you.
Thank you.
In our national program of talks tonight, you were listening to the panel discussion entitled The Learning Curve. The panelists were Dr. Lata Bhat, leading Paediatrician and behavioral and developmental expert; Mohit Ahuja, founder, Knowing Disability Initiative; Nishtha Gupta, former autism awareness and technology advocate; and Amit Arora, media personality, who initiated and moderated the discussion. Produced and presented by Naveen K. Gupta of All India Radio Delhi, this program came to you from the Delhi station of All India Radio.